Is it on? I don't know. Can you hear? Well, but people in the back can't because I'm quiet. Well, I'll try and speak louder. It's just not, that is not my skill set. We're going to do about 10 minutes of, I'm going to do kind of 8 to 10 minutes of didactic, and then we're going to actually put you in solvers to let you really try to work through the first question. There is a worksheet. I don't think I brought enough because we really just expected ourselves to talk to each other. But it didn't have that much to say on it. And if you send me a note, then I will give you one. All right, disclosures. There's our disclosures. Okay, this is our goal. How do you frame a good research question? Because it's the most important thing that you do. If you go down the rabbit hole on a bad question, you won't get anywhere. You'll end up in the rabbit hole. And so the thing about it, so those who know me, I publish, and I publish a lot. I'll just leave it at that. But how? Like the question is like, how do you do that? Like how, when I sit with my chair, it's like, how do you do this? There's a couple things. I'm very deliberate about it. So everything that I do, I think about how am I going to publish this? And Rob is here from Michigan, and he'll remember that every time we started something new in the residency, we would think about what we're going to do to measure it and see whether or not we could change it. And so you want to be very intentional about what you're doing as you work through, because that's how you end up with scholarship. And so I want you to just take a minute and think about, we're going to actually ask you to write a research question today. What's your area? So choose an area today that you are going to work on. Y'all need to too. I don't know. What's anybody to choose? Let's just do it this way. What am I interested in today? I'm interested in coaching. So I'm going to think about coaching today. That's going to be my prom. Okay. But I'm serious. Think of something that you do a lot of and think of something that you want to be working on. And so I'm going to talk a little bit about kind of where ideas come from. And this is kind of for me. I think the first thing is I'm curious. Like I am always curious about what's going on. We were talking in the back about how do you publish in simulation? Like how do you publish an ultrasound? The answer is be curious about what's going on, the activities that you're doing, the way that people are learning, the way that people are teaching. The next thing that I think about for research questions is I'm trying to answer something, meaning that I may be starting something new. So I said I'm interested in coaching, and so I'm interested in what questions might be asked, or how do you do powerful coaching, or am I better to coach my colleague or be coaching somebody higher or lower? There's all kinds of questions that you can ask and that you then want to answer. Then the other thing is really kind of proving something. If you're doing something new, you should prove that it works. And so that would be another place that things come from. And then this is my favorite. I have a lot to say. And so not uncommonly, I write because I have something to say. And so if you look at the perspectives that I'm writing, it is because I have something to say. And so all of these are legitimate for publication strategies. So then specifically, the research questions, they're going to come from things that you observe. They may come from problems that you encounter with a learner. Like if you're working with somebody, is there an issue? I was talking to one of our pharmacists, and I'm like, I think our clinical pharmacists are making it stupider, right? Because I can just call them and ask the question, right? So is my pharmacy knowledge less, right? So these questions, these things that you come across, can you actually ask questions of them that would then become a research question? It also related to the environment, any sort of changes, any sort of measurement issue, how to teach something you read, right? So you can publish on anything. So here's a question. I'm going to give you a couple of examples. So your chair wants to encourage education. You need faculty to engage in completing the assessments, grand rounds, et cetera, and she's willing to allocate some money to do this mission. What do you do? Rob should actually know this answer because these are all Michigan questions, but he may not remember. Ideas? Incentives, exactly. So some sort of an incentive. And so at Michigan, what we did is we implemented an EVU system, right? So you got X number of credits for teaching a resident didactic, X number of credits for creating something, X number of credits for whatever. And then the chair said, you have to have X number of credits to get your incentive, right? Publication. Like that's an easy one, right? Create something, do it, write about it. Next one. So you're sometimes irritated by having an early medical student shadow you. What do you do? I hate having first-year medical students. I don't let people observe me. I'm not any good at that. What are you gonna do? I know you all are feeling this. I'm just saying, you're not gonna kick them out and publish how you kick out medical students. No. What are you gonna do? Anybody? Yeah, you're going to give them a task. Thank you. Exactly. And so I remember talking to one of the other faculty, and she's like, I have this list. She had literally a list that she would give the first year medical students to do. Go out to triage, take a blood pressure, go to radiology, look at an x-ray. Like, she literally had a list for the students of things to do. So I took the list to one of our students and I said, hey, let's do something with this. He created a whole bunch. There's a great publication called Beyond Shadowing, Educational Download. And it's a list of things in case you don't want to deal with your medical students for them to do. And they learn, and they probably learn more than they do from me. I'm just saying. All right. So, here's the criteria for a good research question. And again, I just threw out a couple of wonky ones. But now we're actually going to get to where you are. Here's the criteria. It needs to be feasible. So whatever question you're going to ask, it's got to be feasible. It has to be interesting. And the interesting one really matters, right? Because it's so sad to spend hours and days and months on something and somebody's like, yeah, who cares, right? It needs to be relatively novel. That's the interesting part of it, and add to the literature. It needs to be IRB approved, yes, and it needs to be relevant, right? You got to be doing something with it. So this is called the finer criteria. I did not create them, and I don't remember who did. I think it's mostly public domain. But we're going to ask you to create research questions within the finer criteria. And so let's go through some of these. Which of these are would meet the finer criteria? Feasible, interesting, novel, ethical, and relevant. Okay. What is the relationship between ITE scores and ABEM certification scores? We'll vote. Yes or no. Who says that's who says that's a finer question? Relationship between ITE and ABEM scores. Okay. Who says it's not a finer question? Y'all aren't voting. Busted. Okay. Who says yes? Okay. Who says no? Who wants to justify their thing? I'm going to justify the no. And you may not be very happy with me. It's no, he's now the research director for ABEM. It's known, right? ITE scores, like, exam performance predicts exam performance. It's a well-known question. It's a well-known statement. And so I would say that that's not novel. But if your specialty doesn't know it, it may be novel. Right? So that's where I use my colleagues to say, hey, does this matter? Okay. Do residents who complete a difficult airway course demonstrate better airway management residents that do not complete the course? Finer question. What's the answer? The answer to this is yes, they're probably better. Is that a finer question? Okay, yes. Who's going to vote yes on this one? Okay, who's going to vote no? Y'all aren't voting again. You're killing me. This one's probably a no, right? Somebody gets an intervention and everybody else doesn't get an intervention. It's probably not a really great question, right? Because of course the people who were trained did better than the other ones. Now, if your training session was novel and you're proving that they're better, that might work, but probably not a finer question. All right, does Burke, the order, predict performance in residency? Finer question, yes. You got to vote on this one because this one's like straightforward. Yes. Is anybody going to vote yes on this one? Is anybody going to vote no on this one? Y'all are still not voting. It's a no, right? Birth order should make no difference for this. So this would not be a finer question. Now, so I'm seeing some skepticism, like, oh, the firstborn may be a little bit more aggressive and maybe they're better in residency. Don't twist yourself into knots. Not a finer question. Okay. So we're going to go into small groups now. And I'm going to just run through this last bit. This is the process of kind of creating research. So you're going to come up with an initial question, you're going to do a literature review, create a conceptual framework, refine the question, choose the methods, do the data. And then on the back of the handout, there's a couple of these things. These are just things if you're looking for outcomes that can be helpful. So there's Miller's model of competence, and there's Don Moore's evaluation framework. And so if you're looking for kind of outcomes as you do your question, those are provided to you. All right, we are going for the rest of the time to be in small groups.